RSSDI 2021. I am Dr. Sanjay Kamble, and on behalf of Wockhardt Medical Team, Wockhardt Medical Connect and the RSSDI TV 2021 brought to you by Wockhardt, I welcome you all. So today I have with me Dr. Bharat Saboo sir, who is from Indore. Sir is a renowned diabetologist from Indore, and he just now delivered a talk on a very interesting topic, that is the correlation of systolic and diastolic blood pressure with microvascular complications in type 2 diabetes. So, sir, welcome to the show.
Thank you.
I would like to ask what key take home messages would you like to give to our audiences who had listened to your talk, as well those who missed your talk from the study which you just delivered in the MMS Ahuja Hall?
Thank you. First of all, I would like to thank RSSDI and Wockhardt for giving me this opportunity, and the RSSDI Wockhardt TV for taking me here. Actually, this was a very interesting topic which was assigned to me by RSSDI to present my data from Central India regarding correlation of systolic and diastolic heart dysfunction with microvascular complication in diabetic patients. Now, there were two main key points out of this study. Firstly, we found a correlation which was a very startling and valid correlation between systolic and diastolic dysfunction along with the microvascular complication vis-a-vis retinopathy, nephropathy and neuropathy. So we found out that if we can screen the patient out for neuropathy, nephropathy and retinopathy, which is very easy to do in our day-to-day clinical setting, we can prevent a lot of patients, those who are going to suffer a severe heart disorder at a later stage. Secondly, with this study, we have found that this correlation is there even in the asymptomatic patient. So the take-home message for patients actually out of this is to get screened if they found any of the microvascular complication in them, and patients if they are having a nephropathy or having a neuropathy or retinopathy with diabetes, they should ask their doctor to get them screened for a systolic or diastolic dysfunction. And at the same time, our doctor friends who are listening to this and who have attended the conference should always screen their patients for microvascular complication, because that way they can save many lives. Thank you.
Thank you, Dr. Bharat sir, for those key words that you delivered. Definitely, we would like to know more about this study, and we would hear the whole talk, which would be recorded and would be on the site of the RSSDI. Thanks a lot for sharing your views, and thank you so much for your time. Thank you, sir.
Thank you. Thank you, Wockhardt.